Good afternoon and welcome to our series of webinars focused on bringing you information about COVID-19 related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who's interested to attend. My name is Kathy Caudill. I'm a communications specialist with Quality Insights. Today's webinar will be an overview of an upcoming course from Quality Insights on staffing solutions for nursing homes. Everyone has entered the meeting on mute, but we will have a discussion at the end of this webinar. If you have questions or comments, please submit them using either the chat or the Q&A tool in your Zoom menu. We invite you to join us every Wednesday at 2 p.m. for more webinars in this series. Next week, we'll be discussing risk reduction for medication adverse events. And now I'd like to introduce our guest today, Amy Porter. Amy is a resource specialist with Quality Insights. In her work over the past 5 years, she has been engaged in a diverse range of quality improvement initiatives in Pennsylvania, West Virginia, and Delaware. She has gained extensive experience in continuing education planning, design, and delivery through Quality Insights' diverse partnerships with state government agencies and offices with an emphasis in chronic disease, substance use disorder, and team-based care. She has been a licensed practical nurse for nearly 20 years and holds a Bachelor of Science degree in Communication Studies. Amy, thank you for joining us today, and if you're ready, you can take it away.
Such a pleasure to be with you this afternoon to talk about a new course that Quality Insights recently launched, and we will be getting ready to launch again. So with that, go ahead. Let's go to the next slide. I wanted to start off this afternoon just by taking a little walk through memory lane as far as where we stand with the state of staffing in nursing home settings. Of course, I am certainly singing to the choir this afternoon because all of you I know are acutely aware of the challenges that are taking place in nursing homes related to staffing. You've been dealing with that now for many, many years. But I thought I would just dial back a few years and give us a little bit of a background before we talk a little bit more about the course and give you all some opportunity to chime in with some of your experiences as well. And as the images here on the screen describe, we've all been seeing and hearing in the news, especially in media, that staffing in the medical field as a whole has been a challenge for a very long time. In 2022, there was a study that was published by the American Healthcare Association and the National Center for Assisted Living that surveyed 759 nursing home providers. This survey highlighted that 60% of nursing homes were experiencing the worst staffing situation since the start of 2022. So we're not talking necessarily about today, but this study was published in 2022. And 98% reported that they were experiencing difficulty hiring staff. And so we obviously acknowledge that COVID-19 had a huge impact on staffing and retention. However, as mentioned, even in this study before COVID-19, the median staff turnover at nursing homes was already nearly at 100%. And we were seeing even less continuity at facilities with lower federal star ratings. So workers turned over at a median rate of 94%, and a mean rate of 128%. And this was in 2017 and 2018. So let's see the next slide. Again, this is looking at 2017, 2018. So pre-pandemic, the one-star facilities had this insanely high turnover rate. It was 135.3%. And the five-star facilities, again, pre-COVID, turnover of 76.7%. So COVID really amplified the issues that already existed. And now here we are in what some call the post-pandemic world, trying to figure out what we are going to do about staffing. Go ahead, Kathy, with the next slide. So a couple snapshots here of things that took place in 2022. Coming into the new year in January, CMS began posting weekend staffing and turnover rates on Medicare's Care Compare website. This information was then incorporated into the nursing home 5-star quality rating system. Through this, CMS stated at that time it would hold facilities to a higher I'm sorry, I'm back. Can you hear me, Kathy?
Yes, we can hear you.
Okay. Thank you. So basically, CMS at the beginning of 2022 was just saying they were going to hold nursing homes to a higher accountability. And then fast forwarding to today, and as I know the team here at Quality Insights has hosted webinars talking about the mandated nurse to patient staffing ratios that some states are implementing. I know there's been a lot of conversation about that in both Pennsylvania and West Virginia. So certainly this is a rapidly evolving situation. And Kathy, you can go to the next slide. We know that they can make suggestions about improving staffing, but it's one thing to say that we need to do that, and another thing to actually have the time and capacity to actually be able to put things into place to make that happen. That's not an easy task. So with that, I wanted to turn it over to our audience this afternoon and just ask you, how long has it been since you had no vacant positions at your facility? And you can respond with, I don't have any vacancies right now, 1 to 6 months, 6 to 12 months, or too long ago, I can't remember. We'll let you take a few minutes and go ahead and answer that survey question. Just go ahead and select one. And then Kathy, when it looks like most of the crew has responded, we can see what we have for an answer. I have a feeling I know what it's going to be.
I think most of the answers are in, so
okay.
In the poll and share the results.
Very good. Yeah. This is consistent. We did this webinar with another group at the beginning of the year, and I remember with a lot of clarity that this was the exact same response that we got from that group. It's been too long ago, I can't remember. All right, and we have one more polling question that I wanted to
Before we skip over, I want to read these results out loud because I don't think these results
are
in the recording. So what we have is 0% said, I don't have any vacancies. 0% said 1 to 6 months. 3% said 6 to 12 months, and 97% of you said too long ago. I can't remember.
So basically everyone. All right. We can go on ahead for the next polling question. Our second polling question is, what are the common causes of understaffing in your facility? And so for this question, what we would like you to do is pick your top 3. And that could be budget concerns, staff turnover, overtime pay issues, lack of interested or qualified candidates, an aging workforce, or staff burnout. And I'm sure there's probably other responses you could think of to select as well, but just based on what's here, go ahead and pick your top 3.
Results are still coming in, so we'll wait another minute.
Okay.
Okay, I'm going to end the poll in 3, 2, 1. So the results are...
Yes. We have a mix.
Mm-hmm. Do you want to read the results?
Sure. Yeah, I'll just pick from the top 3 here. We have a mix of different things for almost every single response. It looks like the highest response was lack of interested or qualified candidates at 89%. then followed by staff turnover at 72% and staff burnout at 61% when the other ones were considerably lower. Very interesting. Thanks everyone for responding to those polling questions. So now that we've taken a minute to do that and recognizing that nursing home staffing is obviously a very pressing issue and concern. I don't know that there's a facility anywhere who doesn't have at least some type of staffing concerns, especially with the way things have evolved with the government and the media. So let's take a minute or a few seconds and just stop everything and envision for a moment, if you would, what your workday might look like if you had none or only a few vacancies. Think about that for just a second. How do you think that that would impact team members who are covering extra shifts or managing extra tasks and duties? And I'm not looking for responses here. If you want to type something in the chat, you're more than welcome, but just kind of reflectively think about this for a minute. How would being fully staffed impact the lives of your residents? And think about one thing you would be able to do with the time you spend preparing, interviewing, and hiring for just one position, especially for those of you that have all that turnover that you're trying to navigate. With all of the competing priorities that are part of your role on a daily basis, it could be that it's been a while since you've really had a chance to take a step back and consider not only the current staffing challenges you face, but what kind of practical solutions might be available to help address the staffing needs that you have. Go ahead, Kathy, with the next slide. And this is where Quality Insights really is coming in with the aim to help. And the reason really that we have you here on this webinar today, Quality Insights has developed a course series that is titled Staffing Solutions for Nursing Homes. Discover how to create a workplace culture staff won't want to leave. And this will be launching soon. Actually, we currently have scheduled for the first course to launch on August 1st. So you might want to jot that down. And Kathy is sharing right now in the chat a link to a course flyer that you can download that explains more about what I'm going to talk about here today. But if you'd like to download that, you are welcome to do so. This is a unique course series for Quality Insights, and for the last group that we worked with, it was unique for many of them as well, and I'm going to talk about that. But we've really designed this for nursing home administrators and nursing or registered nurses who recognize the importance of staffing and want to plug in some up-to-date principles, strategies for hiring, staff retention, improving workplace culture, and clinical care processes. Next slide, please. Let's talk a little bit about some of the benefits that come along with participating in this course series. First of all, this is a free course. So when you register, there's no cost involved in terms of dollars, and it is eligible for both nursing and nursing home administrator continuing education credits. When the course series is completed, it's right at about 5.5 continuing education credits that are currently available for participating in the series. It's designed to be a 90-day online program. Now, this isn't suggesting that you're in there every single day for 90 days trying to do some sort of education. We know that's not feasible for the type of workload that you have on a regular basis. This has been built as a 90-day program in order to give you an opportunity to, number one, do the course, which takes roughly about an hour once a month to complete of the 3 courses that they're available. They're about 60 minutes in length. And the idea here is that giving you about 90 days gives you time to complete a course, work on some data collection and upload. And then if there's activities that you want to participate in, there's a little space to think about how you might want to do that. So there's some flexibility there as far as the time goes. So 90-day online program. There are data reports. I already mentioned that data collection is encouraged as part of this program, and I have a slide for that next we'll talk about. But when you collect and submit data, Quality Insights will create a report for you that includes both publicly reported at the national level data, as well as the data that you are submitting to us. So when the data is collected, we'll send you a report back with some good information to help you really identify what opportunities may exist for improvement, but also help highlight successes. If you can see where some of the data is tying back to successes that you're having with your staff, you'll be able to highlight that as well in the report. Cohort learning. What we mean by this is that when you register, and anyone else who registers for the program, you are put into a group, and that group moves through the course series together. So if you sign up today and you join us for the kickoff webinar that's coming soon, the rest of the individuals who signed up for the course will be there as well. So there will be the group of people that will go through the course together. And then awards. We are still ironing out the details of the awards for the next group coming through, but we do definitely want to award any facilities who are committed and able to submit data and complete the course series. So we'll have more information about that coming soon, but there will be awards. Next slide, please. And this is the data slide that I just want to touch on today. When you sign up for the program, you will get more information about what is involved with each of these items, but I just wanted to touch on each of these today in a little bit of a commercial style, just to give you an idea of what sort of data is looked at during the program. The first one is the CMS Staff Satisfaction Survey. Maybe you're familiar with this. It's been around for a little while, but maybe you're not. It's a free survey that takes about 15 minutes for a staff person to complete. And it asks them a short series of questions of things related to staffing, workplace culture, shifts that they work. Do they feel fulfilled in their role? There's a variety of different questions that the survey will ask. When these surveys are completed, there is a data tool that CMS has published where you can enter the results, and it will give you a wide variety of different information about staffing in that tool. This is something that we talk about in detail in course 1. And if this is something that you wanted to participate in, which we do encourage, it doesn't have to be with your entire facility, but could even just be a small number of individuals, we will help you. If you need assistance loading surveys into the data tool, or if you have questions, we are here to support. We have technical assistance both over the phone and many times in person where we can come and support you if you need help. So we're here to do that. The next one is I'm going to talk about the next 3 together. Self-reported termination rate, resident safety events related to falls, and PPE for transmission-based precautions. The first 2, the self-reported termination rate and the resident safety events related to falls, are very brief forms where you're primarily filling in numerator and denominator information. It's a 1-page. There's a maximum of about 4 fields on there where you can pull information to put into those forms. And the PPE for transmission-based precautions is really a checklist that can be completed by staff to help you track PPE use in your facility. The final one that I wanted to touch on is the Joy in Work assessment. And this is something that we introduce in course 2, so it doesn't come right away. But this is more of a fun, very simple activity versus what you might think of for data collection. This particular activity comes with a poster, and it asks your staff if they've had, very simple, if they've had a good day or a bad day. And they can put something like a pom-pom, like a little craft pom-pom ball, into a container to say, yes, they did have a good day, or no, they didn't. And it gives you and the staff a very visual way to measure the climate, either in a particular unit or across the nursing home as a whole, about whether or not people are having good or bad days. We do have a more structured data tracker for this that you can use. But again, these are all introduced in each of the courses with further instruction and further assistance as you need it. But because we do feel that the data collection component is important, I just wanted to mention that today to give you an idea of what's involved. Next slide, please, Kathy. This is a screenshot of the learning system where the courses are housed. We do host 2 webinars with this particular program that many of you are familiar with joining Quality Insights webinars, so that's not new. But what may be new is our learning platform called MyQI. The 3 courses that are involved with this series are housed here. So when you register and sign up, you'll have access to the courses right here in the platform. And we'll provide more instructions about how to access that, but everything lives here online, as well as recordings of the webinar. And also the data upload platform will live here as well. So you'll do everything right within the e-learning system. Next slide, please. Okay, so the course series follows a progression. I've spoken to that a little bit already. The first part of the course series or the course journey is the kickoff webinar, which we have scheduled for July 27th. That's a Thursday at 1 o'clock. And we will forward an invite link to those who register for the program. So they'll have the opportunity to participate in that. Our medical director, Dr. Storm, will be joining us for that particular webinar. And we'll be talking all things staffing. And we'll also be helping you get off to a good start. We're going to walk through the e-learning system. We're going to walk through the data platform. We're going to do everything hands-on as much as we can to help get you started on the right foot. Next one, Kathy. Then on August 1st, Course 1 will launch. Course 1 is all about hiring. We talk about how you can start prioritizing staffing goals, how you even come up with staffing goals, more about hiring and attracting the right kind of people that match the culture of your facility, and interviewing with a fresh perspective. Lots of great tips and tools in there about hiring. Course 2, our next block there, is all about staff retention. We really hone in more on this particular course about how to develop a workplace culture that staff won't want to leave. It's worked into our title. How do you create a vision for change if there's change that's needed? How can we do that? We use an evidence-based model for walking through the change process. And also culture change as a quality improvement effort. How does this impact the work that you do? How does culture and quality improvement tie together? Course 3 is about evaluating. It's really more even about engaging the staff that you have. So based on the types of staff that you have, there's a wide range of personalities and people who are part of your organization. How do we bring them all together to work together? How can you help motivate different types of employees to be the best that they can be and want to stay and be successful at your facility. And then our final one is the closing or celebration webinar. We'll have a keynote speaker for that as well. We will review successes from the program and do recognitions for those who have completed courses, submitted data, and we'll also have an interview with the keynote speaker as well. So that's a bit of a walkthrough through the program. I mentioned that the kickoff webinar is coming on July 27th at 1 o'clock, with the first course launching on August 1st. And then course 2 will launch a month later in September, course 3 in October, and then we'll wrap up early in November before the holiday season really comes into swing. So that's a little bit about the layout of the course. Next slide, please. Now, we've talked a lot about the courses, which are designed primarily for nursing home administrators and registered nurses or other nursing home leadership. But in a staffing course, we can't leave out the staff. That wouldn't make a lot of sense. So built into the course series are staff toolkits. For every course, there is a relevant staff toolkit that speaks directly to your staff from where they are about topics that tie back to what you're learning in the other courses. Each of the toolkits has nursing CE available at no cost. It includes knowledge application resources, and again, just useful information to help your staff grow and think about things that are pertinent to what they do day to day. Next slide. And we've tried to do this in a way that's not boring. We've developed videos, there's games, we've included emotional wellness resources. Again, I've already mentioned the free e-learning resources, but there's many topics on that as far as helping your staff understand that they also are leaders in their role in one way or another. So we have that sort of information, communication tools, lots of really good professional development opportunities there that are based on evidence-based literature and practices. Next slide. All right. When we were developing this course series last year, one of the things that kept coming to me was that old saying, which you've probably heard many, many times, that says, "I can't see the forest for the trees." And so we picked this graphic here. I think it's a great metaphor to describe how easy that it can be to lose sight of the big picture of staffing because there's so many things that crowd it out. You all have so many competing priorities. It's just difficult to carve out the time that you need to be able to think about this. Our aim through this course series is really just to highlight how staffing is such a key driver to the overall success of your organization. And we want to help you start the journey of actualizing processes and workflows that will help improve your nursing home as a whole. I really emphasize here that we understand that this is a journey. This course series is designed to be 90 days. We know that anytime you're trying to implement something with staffing, it's going to take much longer than that. But if you can pick up even one tool or resource that benefits you, that you are able to actively implement at your facility, I think that's a win. And so that's really what we're going after here, is just helping equip you with more tools so you can be successful with staffing. Next slide, please. So let's talk about how you can register for this course series. Here up on this slide, we have a link, and that's going to be coming over to the chat as well. The QR code is also available that goes to the link. When you click on that link, it will take you to a login screen. There is also a tab on that screen that says sign up. If you have never accessed the MyQI platform before, which my guess is the majority of you probably have not, you will want to click the sign up tab, and it'll ask for your email, your first and your last name, and then there will be a button there to go on to the next step. When you've done that, you'll be able to create your account. It will prompt you to answer just a few course enrollment questions, primarily related to things that we need to help process your credit if you're wanting to collect the continuing education credits. And then after that, you're going to just watch for updates from our team here at Quality Insights leading up to the date of the kickoff webinar, which I said would be on July 27th at 1 p.m. And we'll send additional details to help get you started. But it's really pretty simple to sign up. If you do run into any hiccups with the sign up process, just reach out to us, and Kathy on the next screen has my contact information, and we're going to be putting that in the chat as well. But we really invite you to sign up for this course series. I'm honest in saying it is a commitment. There is going to be some time that you will need to invest in order to work through the courses and get the most out of the program. But this really is such an important issue, and we really believe you'll see the value in participating. So we hope you'll join us. And with that, I see that there's some messages here in the chat. Kathy, has anybody had any questions? Or if you do have questions, feel free to put them in the chat or raise a hand, and we will talk about those. And I'll look at the chat while we're doing that.
All right, thank you, Amy. And before I read the questions, I'd like to run over a couple closing items, and then we can get to your questions. As Amy said, you could put your questions in the chat or the Q&A, or you can raise your hand if you'd like to request to be unmuted. While we're waiting, I'd like to invite everyone again to next week's webinar, which will be discussing risk reduction for medication adverse events. That will be same time, same place next week on Wednesday at 2 p.m. We also invite you to bring your questions to our virtual live chats every Tuesday and Thursday at noon. Deborah Wright will be there to answer your questions on topics like quality improvement initiatives, infection control, or MDS coding. You can find the links to those live chats and our webinars in the newsletter we send out every Friday called the Last Minute Lowdown. And if you'd like to receive that newsletter but don't think you're on the mailing list, you can email me at ccaudell@qualityinsights.org. And I put my email in the chat along with Amy's. So Amy, earlier when you were doing your presentation and we're asking, doing the polls and things that people were saying were causes for vacancies. One person commented was that missing agency pay rates was a big one for them.
Yes, that could definitely be added to that list of selections on that particular polling question. That's something we've heard frequently. It is very hard in some areas for the facilities to be able to compete with the agencies. I think I feel like this could be almost its own webinar unto itself, especially in rural areas where you might not have as much capacity to utilize some of the newer technology that's coming out related to talent acquisition. The agencies especially can be really challenging. So that's a great point. Thanks for bringing that up. I did see a question in here from Ron. He was asking if this would also benefit recruiting directors at the facilities or only admin and RN. We welcome any nursing home leadership to participate in this program. Ron, I do think as a recruiting director, this would definitely benefit you. Something we found in the last group that we did, we had some different nursing home leaders who would sign up, and after they'd been in the course for a little while, they would say, hey, could I sign up a different staff person to come and help me with this? Or could I have somebody else register? I think this would really be great for the DON to participate in. We had a few different requests like that. That's fine. We're very flexible that way as far as who joins. But yes, to your question, really any nursing home leaders are welcome to participate. Excellent. Thanks, Ron.
So we have another question here. It says, will there be more instructions about what we need to do? I'll be using this learning website and we'll probably need more information.
Yes, absolutely. We will be going over online how to navigate the e-learning system on the kickoff webinar. I'll be walking you through step by step. We'll have a recording of that webinar available. And we're also going to have some short video, very short, like less than 3-minute video clips available sort of as tutorials to help walk you through. So if you need a refresher on how to submit data, or if you're not sure how to navigate to the courses, we'll have resources available related to that. And I'm always available, as well as the QISs that you work with on a regular basis. So yes, there will be more information.
Thank you. We've got a couple more questions. One person says that it sounds interesting, but they don't have time to do this course right now and wants to know if it will be available later.
Yes, we will be doing at least one more iteration of this course series, and that will start January 2024. So we will go through this, what we're calling the second cohort. We'll go through the second group, and then there will be at least one more offering at the beginning of January that will start. And that's available for registration too. So if you even wanted to register today, in the registration fields, there's a drop down for which one you want to participate in, and the January course is there. So if you select that one today, we will follow up with you a little closer to the time just to make sure that it's still good timing for you, but we'll have your information and can follow up that way.
Thank you. And here's our last question. So if anybody else has a question they want to get in before we wrap up, now would be a good time to drop it in or raise your hand if you have a question. This question says, is about the continuing education credit. It says, would I get credit after each course is completed, or do I have to complete the entire program to receive the credit?
Also a good question. So for the two webinars that I mentioned, both the kickoff webinar and the celebration webinar, you receive your continuing education credit immediately after you're done. So just like a standard Quality Insights webinar that has CE, same process. For the actual courses, you would need to complete all 3 courses in order to earn the credit for those. So that's basically how it works, but it's a total of 5.5 CEs that are available total for both of the webinars and the 3 courses.
Okay, it looks like that's it for the questions. Amy, we have that SurveyMonkey registration link. Do you want me to share that and talk a moment about it?
Sure. Yeah, that would be fine.
Okay, I put that in the chat.
If you have trouble with the link that we had posted on the slide, or if it doesn't work for you, I know sometimes in the nursing home facilities, depending on what level of security you have on your computers, you might not be able to access a bit.ly link like what we shared today. If you can't access that, we invite you to click on the SurveyMonkey link that Kathy just posted. This will take you to a standard questionnaire that asks the same sort of questions, and we will register you that way. So that's just an alternative way to sign up. Either way is fine.
All right, so that is in the chat now. I will be emailing everyone here later this week with all these links that you need to the slides, to the registration, to the recording for this webinar. So if you need to go back and rewatch it, you'll have that, and I'll probably be sending that around by the end of this week, probably on Friday morning. And I think that's all the questions we have. Amy, if you don't have anything else, I will go ahead and wrap us up. Do you have anything else to add?
That's all. Thanks everyone for having me. I really appreciate your time this afternoon.
Yes, thank you for joining us, Amy, and thank all of you for joining us today, and hope that you can join us again next week.